Good morning, everybody. This is Dr. Beck here at LifePoint Medical, and it is the November the 19th, and we're up and running this morning. However, I will let you know we've increased some of our vigilance around here in the office to a pretty high level. When it comes to treating our patients, I want everybody to know that we are not having anybody who's symptomatic come in the office, okay? Okay, but that does not mean we're going to abandon you or not take care of you. It means that if you are symptomatic or you feel like you've got any kind of virus going on, we can see you through telehealth, and we can use our drive-through services to get any testing done that we need to. Okay, so if you feel like you need to be seen or you're worried, give us a call at 706-782-0016 and let us help you. And please, we ask that you be cooperative with us, okay? Because we're not trying to get people, we're trying to manage this in a responsible way. So if you're symptomatic and you feel like you need to see the doctor, we want to be there for you. We just won't see you in person. And I talked a little bit yesterday about, things that would prompt you to reach out to us. The main thing with this COVID-19 is shortness of breath. If you feel like you can't breathe or you're having trouble breathing, okay, that's a point where you probably need to talk to me or call the office here, or better yet, go to the emergency room if you're having trouble breathing. Some other things you can do if you've got one of those oxygen sensors at home. If you're above 94%, you're pretty safe. You don't have to do much. Just ride the storm out if you've got COVID-19. If it's from 91 to 94%, you probably need to reach out to us so we can just talk to you about what's going on. And then if you're below 90%, then you need to be seen in the emergency room. Now, what I'm talking about with these oxygen sensors, you can get them from the nursing home, any pharmacy here in town, and just thing that goes on your finger, the thing we stick on your finger when you come in the office to check your oxygen saturation. That's what I'm talking about. So, and they're pretty cheap. They're less than $20. I know you can get them online for less than $20, and I think you can get them around here at the pharmacies in the community. So if you're worried or you want to monitor yourself somehow, that's the way to do it. The only caveat to that is some people run below 94% all the time, and usually those people know who they are because they're on treatment for asthma or COPD or something like that. So it just has to be taken into context of who you are and your current medical conditions. The main thing I want to point out, though, is we'll see you, we'll address it, we'll do what we can for you if you are positive for COVID-19. As far as the COVID-19s here in the community, we had 513 attributable cases this morning, which was up from 506 yesterday, so it's up about 7. I do hear rumblings around the community about this going around, and I'm concerned about, I know the schools are having to do some adjusting and everything else, and we're aware of that, and we're just going to try to navigate ourselves through it so we can keep taking care of you and take care of people with COVID-19. Now let's talk about drive-through services. Our drive-through services are up going. We did get the COVID-19 rapid test in, so we've got a fresh batch of those. I will tell you there were 6 or 7 cars lined up this morning to get them done this morning. Those are cash only. They're $60. They're reasonably accurate, okay, but none of these tests are good. We don't know enough about what's going on to say what's a good test and what's not. Nobody does. It just takes time, like years, to figure out what's good and what's bad, and we've threw all this together in months, so we have to compensate for that somehow. However, we are seeing some positives come through the drive-through line and some negatives. So if you need that service, let us know, and you can just call us, and we'll coordinate you coming in to get that rapid test done on a drive-through basis. We'll also do the flu shots through the live drive-through, and we'll do B12 shots through the drive-through, as long as we have a way to pay. Now, one of the things is if you want the nasal swab and you're a current patient of ours, like you're in our system, we can order one of those for you, and you can just use the drive-through. We can grab it for you, and we'll bill your insurance like normal. And I think if you did the rapid and the nasal together, that's probably going to give you your most conglomerate accurate results maybe. Plus your symptoms and things like that can all be plugged into there to say, does this person have or doesn't have COVID-19 and everything. But the main thing is, if you need those services, drive through. I think it's the safest way to do things, and it protects us and protects you from this virus. In general, you know, if you're older or at high risk, don't let this don't test this virus out. Stay keeping your distance and stay safe, and stay using your alcohol, hand sanitizers and everything else, and your mask, wearing these masks around to help decrease the spread of this. Listen, we're open. We're navigating our lives just like everybody else is with this COVID-19. Please call us if you need something so we can get you taken care of in a timely and appropriate fashion. Have a great day. Thank you.